Dr. Santosh Mahapatra. He's going to speak on 52 weeks safety and efficacy of optogenic therapy for vision restoration in RP with ABCA4 mutation.
This study, I'm the principal investigator. I have no financial interest. All the papers related to ethical clearance and genetic study have already been submitted to the scientific committee as desired in the last year. So why optogenetic gene therapy? It's because the available therapies for RP, like use of electrodes, are invasive and has limited resolution. The classical mutation-specific gene therapy requires presence of photoreceptors, and they are not available in advanced RP. But in optogenetic therapy, you can introduce a special gene that enables these neurons available to be stimulated to the ambient light, and it is effective for varied disorders. And the monochromatic opsin, which was earlier used, required intense light, produced suboptimal stimulation, and required goggles to stimulate the retina. In contrast to the multi-characteristic opsin, which we have used, is activated in ambient light and generates significant photocurrent without use of goggles. And this is delivered by a very simple approach of intravitreal injection into the eye, just like any other intravitreal injection. And the target cells are bipolar cells. And here we had 11 patients which are included for the study, but out of them, only 4 had ABCA4 mutation positive patients. And the key enrollment criteria was either light perception or hand movement, and in the other eye, there was no better vision than counting finger. And all the subjects in this group are in the high dose group. So this is the gene panel for all the subjects which are included in the study, 11 subjects. Out of them, subject number 5, 8, 9, and 10 had ABCA4 mutation. And all the subjects underwent neutralizing antibody testing at week 4, which showed there is no neutralizing antibody found to the MCO. The safety profile in all these 4 patients we had no serious adverse effect apart from 2 subjects had 2+ AC and vitreous cells, and 2 out of them had mild increase in intraocular pressure, 2 had mild increase in inflammation, and all subjects were well controlled with topical medication, and no subject required any additional oral steroid or glaucoma surgery. There was clinically significant improvement in visual function, which was correlated with visual fields in 2 subjects, and the fundus autofluorescence showed a longitudinal increase in response in all the subjects, which are showed through fundus autofluorescence till 16 weeks and which are maintained till 52 weeks. Here is a patient which video. Yes. Yeah. Here is a patient who was tested on the Y mobility test and instructed to locate the light. You can see he's very grossly moving and not able to locate the light pre-injection, and at 16-week injection, the same test, same patient, and you can see the way he is moving and trying to locate the light, and he is exactly locating light in his left as well as right hand. So to summarize, there is no serious adverse effect on study safety profile with only mild increase in intraocular pressure and ocular inflammation, which are well controlled with topical medications. And there is no increase in neutralizing antibodies against MCO in serum, suggesting there is no systemic immune response. And the dose-dependent efficacy at 52 weeks after single intravitreal injection was proved by improvement in fiber visual acuity, less error and time in visually guided response in eye mobility test, high visual field index, and improvement in discrimination of shape and optical flow direction, as well as increased NEI visual question function error scores. And with this good safety and efficacy results, a randomized double-masked control study is being conducted at US at 6 centers at this point of time. I'd like to thank my co-investigators and authors for this wonderful study. Thank you.
So any question?
The material you inject actually is supposed to stimulate the bipolar cells?
Yes, because all the subjects included are advanced RP subjects with very little photoreceptors present, and presence of bipolar cells and ganglion cell layers were demonstrated in pre-injection OCT.
But there are only ganglion cells which are supposed to be light sensitive, not bipolar cells. How do you confirm that it's stimulating bipolar cells or ganglion? Is there any way?
Yeah, we are taking a M-cherry for autofluorescence testing before and after the injection also, which is shown in the photographs.
Okay, thank you. Good, good. Hope we'll get more results in future.
Yeah, this is the pilot study which was conducted in our institute, and they are planning to come back to India with multi-center study for the phase 3. Now it is going on in US at 6 centers.
Very good. Yes.
No, it is coming from US with respective clearances from the Government of India. Yes, we have taken ethical committee clearance, and that point of time when the study was conducted in 2019, that gene therapy specifications as per the Government of India guidelines. And all the papers we have submitted to the scientific committee also. Last time I presented the 16-week data, preliminary primary endpoint report, and also participated in Colonel Langachari. And this is the 52-week data which I am presenting.